anyone needs to skip out halfway through or anything like that. Thanks all and welcome for participating in our client enrollment and data collection webinar. We thought it was important for you guys to start to get familiar with what we're going to be asking you to collect, and also someone needs to mute their line, I think. All right, there we go. Is the music gone for everyone? All right, let's try this again. All right, so first off, I just thought it was important for you guys to figure out what exactly is expected of you guys to collect when you're enrolling your clients. First I'll go over our agenda here. First I want to go over any Engage evaluation updates we might have since we may have talked last time, which I believe was probably the webinar we had several months ago. Also I want to go over our specific data collection requirements and also the enrollment instruction process. For those of you that have worked on SAMHSA grants before, I'm sure you're very familiar with the GPRA. I'm going to go over in a little more detail the IPP indicators and the GPRA noms. Then I also want to go over our SurveyMonkey and paper forms. And then also we'll finish off with what's to come. And these are things that are not going to be expected of you right away, but are actually coming pretty soon. So I figured it'd be best to touch on it a little bit. Okay, so for the evaluation updates, we've actually selected our vendor for our data system. After our RFP process, we selected the Interaction Information Technologies out of Arizona to provide our statewide EHR for Engage. And so the purpose of this data system is mostly to facilitate the enrollment process, help you guys collect your data, and then submit to us here at Ohio Moss. Then also to help facilitate the wraparound planning process and inform CQI. We have a lot of details on the way, and training should be coming up in the weeks prior to the launch. We're actually looking at a January 1st launch date for that, so be on the lookout for that. And I also want to give just a heads up that we are looking for volunteers from you guys, that anyone who might want to take part in the discussions about the development of the system, anything that you guys might want to see in terms of reports building, any specific indicators or outcomes that you might want to collect at your site. Basically, we want this data system to be as useful to you guys as possible, so we wanted as much input from you as possible. So if you are interested in possibly taking part in that development team, feel free to email myself, and I have a slide here at the end with all of our contacts in case you wanted to get involved in that. We're also currently working with the fiscal department here to determine the best process to dispersing the money to you guys. Right now we're looking at about an October 1st date to begin enrolling clients and submitting your data. So I know some of you might be chomping at the bit to start enrolling clients and sending us your data, but if you could just wait until that date, that's when we really have to kind of figure out what exactly how we're gonna do this, whether it's by monthly, quarterly. So we don't want to get people going before we know exactly what we're planning on doing with the money. So, and again, if anyone has any questions throughout the webinar, feel free to raise your hand or put the questions in the chat window. I can stop. Any of us can answer them at any time. So here's a handout I made that basically lays out all of the data collection requirements that we're going to have throughout the process of Engage. I've highlighted right here what's going to be required of you guys at enrollment to actually receive your $1,000 per child at enrollment. And so, like I said, we'll have the GIPRA NOMs, the GIPRA IPP indicators, and then the Ohio Youth Scales, which a lot of you might already be familiar with. So our method of collecting these is, for the time being, paper form and SurveyMonkey. Once we get the data system up and rolling, everything will be automated and we'll no longer be accepting the SurveyMonkey and paper form surveys. But for the first couple months until the data system's up and running, this is going to be kind of the way things go. The timeline for those is each of these will be collected at enrollment. Then they'll also be collected every 6 months, and then either at 12 months or discharge of the client. And I think you've all seen that the payment is also tied to the 6-month and discharge data submission, so that shouldn't be a surprise to you guys. Who's going to be involved with these data collection processes? It'll likely be the youth themselves. That most of the questions are directed towards them, but it could also be their parent or caregiver if the child's somehow unavailable or unable to answer the questions. The GIPRA IPP indicators, on the other hand, will actually be collected every quarter, and I'll get around to that later, but these will be completed by the project lead or the data lead of your county. And again, the purposes of collecting these are kind of different. Obviously, fulfilling federal SAMHSA grants requirements are the main reason, but then they also kind of give some good outcome data and are able to show kind of what exactly is working, what isn't working, and also helps us guide CQI and kind of track these kids over time to see what what kind of progress they've been making. So like I said, if you've ever worked on a SAMHSA grant, I'm sure you've had to collect GIPRA before. That's a part of the Government Performance Accountability Act. All SAMHSA grantees are required to collect and report performance data using the approved measurement tools. So these tools include the client level NOMs as well as a programmatic component, which is the IPP indicators. The client level NOMs are going to be your enrollment data, then 6-month and discharge. The GIPRA IPP component is more of a process-driven infrastructure quarterly component that we ask all of our sites to complete so that we can help basically judge what the challenges and successes were in implementing wraparound throughout the state. Then that can help inform other programs across the country and even other counties in our region, and helps create a model for successful implementation. So I'm sure what you guys mostly of you attended here today was to figure out how you're going to get paid. So basically how this is going to work starting October 1st is that you're going to complete one of the following of these forms for each youth that you enroll in the program. It should only take about approximately 60 minutes to administer these measures. You could usually do it, you can do it on the phone, you can do it in person. There's definitely, you have the freedom to kind of complete these as you will, but you do have to complete and submit these to get your $1,000 per youth at the enrollment. So first you have either the option of a hard copy format or you have the SurveyMonkey online enrollment. The hard copy format, basically you would print off a PDF version of the form, sit down with a child, mark, basically fill in bubbles, then you'd scan that document and send it back to us so that then we can submit it to SAMHSA and put it in our database of kind of that we're going to look at all the different variables and different demographic information and all that kind of stuff. Since you are all different clients and counties, we are going to require identification numbers. We also need to comply with HIPAA regulations and keeping our data organized. So as members of Cohort 1, all your study IDs are going to begin with 01. I think we're going to basically give you guys numbers on the order that you submitted your cooperative agreements. Once we start enrolling clients, you will each be given an identification number. So basically how it will go is the engaged youth should be assigned an ascending number beginning with 1. So first your cohort will be 01, then followed by your county ID, which could be either probably 1 through 27 here for this first cohort, and then your client based on however many clients you have enrolled. So the example for the first cohort, first county, first client would be 010101. So I'll go ahead and give you guys a little demo of what the enrollment form looks like. The SurveyMonkey enrollment looks like this. I'm sure a lot of you have used SurveyMonkey before. Basically, this is all HIPAA compliant. It's really easy for us to use. So you'll just enter the client ID, again your study ID number, so depending on whatever county you are, say you were the 5th county to sign your cooperative agreement, you'd be 05 and then 01. And most of this is required data, and you're going to have to fill it out to get to the next page. Any question with an asterisk next to it, you will be required to enter in order to get to the next page. And again, either the child or the caregiver could be the one responding to these questions, so go ahead and put whichever that was. Looks like I forgot to figure something out. Okay, so most of these questions begin with demographic, basic stuff you're going to want for your enrollment purposes regardless, birth date, race. Then it gets down into more of the mental health functioning questions. So you've got functioning. Most of these are strongly disagree, disagree, undecided agree, strongly agree type questions. Then we start to get down into drug and alcohol use type questions. There's a GAF calculator that we're going to have for you guys to use. Date the GAF was administrated. There's a couple questions about military service within the family, the social connectedness scale. Then there's also housing. So has your child been homeless in the last 30 days? They've been in a mental health hospital, any kind of, basically where they want to know where they've been for the last 30 days. Living situation, then also any kind of education enrollment, school absences, highest level of education your child has completed, and then any kind of criminal justice involvement your child may have had. So that's basically the extent of the client level GIPRA. I'm sure a lot of you guys have completed this before in other grants you've worked on. We also have, like I said, the Ohio scales. And some of you may have seen this before. They really want to know to what degree has your child experienced the following problems in the last 30 days. And all this is really important to track throughout their time in the wraparound process. This, again, shouldn't take more than, I would say, about 20-25 minutes. So along with the GIPRA, both of these measures should only take about an hour per youth. Okay. So moving on, I mentioned the GIPRA IPP indicators, which are the more programmatic aspect of the evaluation. These are not client-level measures. These are basically just any kind of infrastructure, policy, financing, mental health awareness type things, activities that your agency might have done as a result of the Engage grant. So every quarter, we're going to require you to do a SurveyMonkey in which you will answer the following questions. If your agency's completed any policy changes in the last 90 days, any number of organizations or communities that have improved readiness to change their systems, workforce development. There's a couple different financing measures that we need to collect. Then we really want to know what kind of partnerships and collaborations you guys have entered into, any MOUs or sharing resources with other agencies in your county. And then also we need to know about the number of consumers and family members involved in the planning process, involved in evaluation, and then also the number of individuals that may have been exposed to mental health awareness messages. So this could be if you guys do any kind of social media involvement, if you presented it at a conference, or if you maybe were at a state fair or something along those lines. We want to collect that kind of data also. So here's your schedule to report the GIPRA IPP indicators. The quarter kind of coincides nicely with our enrollment date. So on 10/1/2014, you'll need to keep track of the previous measures throughout your first quarter of enrolling kids. And then your submission deadline for that, it would be January 15th, 2014. Then the next quarter would be due at April 15th, 2015, and so on. And I'll show you the SurveyMonkey that we've built for that. Again, this is pretty basic. You put your county name, whoever it was within your county that responded to this. Yeah, and this shouldn't take very long at all, and it's once a quarter. So, and a lot of you may not even have some of the changes made. You may not have made any policy changes. You may not have entered into any MOUs or any finance policy issues like that. So this usually is a pretty basic form to fill out. Okay, so right now, how we're going to work this out before the data system is built is that once you submit the data to me, the Engage Grant fiscal staff is going to be notified. How we're planning on doing it right now is hopefully each month I'll give a list of counties and clients to fiscal. Then they will be able to disperse your funds probably on a monthly basis. We're not sure exactly how long it's going to take from when I send that list to fiscal to get the money out, but hopefully it should be within 30 days of submission. Don't hold me to that, but that's kind of our thinking at this point. Then the remaining funds will be dispersed the 6th month at $565 and discharge with $533 data collection points. And again, that's also pending the receipt of your quarterly IPP SurveyMonkey. Hopefully the data system will be fully implemented by that time, so the SurveyMonkey and hard copy client level GIPRA and Ohio scales will no longer be needed, and you can do all of that in the data system. And that's really the thinking behind that, is to make it easier on all of us rather than doing paper and pencil or getting online and doing a SurveyMonkey with the kid. Using your data system should be easier for everyone. The 6-month and discharge data will be a little different than the enrollment due to different data requirements. You're going to need to input service utilization data, and there's also a whole other section on perception of care. In addition to that, once the data system is up and going, we do have some other things on the horizon that we're going to start collecting. And again, this is not in the current moment. Like, this is basically at the very least January 1st, and it's probably going to be more of a slower rollout because I'm sure we're going to have some bugs to work through with the data system. but we also want to collect the CANS, which is the Child Adolescent Needs and Strengths instrument. At this time, Chris and I decided that we wanted to do a little poll. I wanted to ask you guys how many of you are currently using CANS in either your agency or your county. All right, looks like about everyone's finished. It seems only about 7% of you are currently using CANS, and this is kind of what we expected. What we plan to do with this is hopefully over the period of the next year, once the data system's up and running, take some of the counties that are especially interested in implementing CANS in their system and working with them, getting them the right training, and then hopefully using that first cohort of volunteers to then go on and train the rest of the counties once they're kind of up and ready to go. In case you guys haven't heard much of the CANS, it's basically an assessment tool that reports needs and strengths in 6 domains: life domain, functioning, child strengths, acculturation, caregiver strengths and needs, behavioral and emotional needs, and child risk behaviors. We've kind of decided to head in this direction. It's kind of catching a lot of steam nationwide. A lot of states are requiring the use of it in all their child-serving systems. And it aligns really nicely with the goals of wraparound. So we kind of thought that this would be a great opportunity for us to get Ohio on the ball and start using the CANS. This slide kind of goes over some of the nuts and bolts of it. How the scoring works. 0 indicates dimension where there's no evidence of need. 1 requires monitoring, watchful waiting, preventative activities. 2 indicates the dimension that need or risk behavior is addressed. And 3 indicates that it needs immediate or intensive action. The comprehensive version of CANS for youth 5 through 17 has been selected because, again, it really fits kind of our population, but then since we also have some over 18, we're going to use the ANSA-T, which is the CANS kind of sister scale for 18 through 22, I believe. And if you guys want to go ahead and get ahead of the game and check out the CANS, you can follow this link. And again, the reason why we're looking at CANS is that there is interest in many of Ohio's child-serving systems in implementing this. And it also will really help with our CQI process. So actually, I was going to hand it over to Chris Thorman for a second, and he was going to talk a little bit more about the CQI component of the CANS and also go over a little bit more of our case management data. Chris, are you there?
Can you hear me?
Yeah.
Hey, Scott, this is Chris. Okay. Hey, I'm just showing the quick poll still on my screen. Do you see the slides?
Let's see if I can get rid of that. Close. Is it back to the screen yet?
Yeah.
Okay.
Yeah. Okay. So, as Scott was saying about the CANS, it's a tool that has kind of generated a lot of interest as a simple, kind of broad-based tool that works across different child-serving systems. Child welfare especially has been looking at the CANS as a tool for level of care, and a lot of folks like it because it's tied to some of the treatment planning as well as outcomes at a system level for looking at change. So our interest with the cans is also it's a more sustainable tool that we could keep using after the grant. So when things like the GIPRA and the NOMS end with the grant, the cans is something that will keep going. We want to keep offering the database, the wraparound supports, as well as outcomes to help us with growth and planning and expansion. So we're looking, for folks that have some experience with the cans, folks to join with our development team about, using it, and then have experience, and then try to find ground level support for folks that want to use the cans and get certified and trained, because a lot of agencies are finding the tool to be useful in other areas. So on the next slide, the case management plan. Case management data. So probably many of you have existing client case management tools in your organization. The one that we're building is for a lot of folks that either don't have one or don't have one that's kind of built around wraparound. So the case management tool we're building will accept the NOMS and GIPRA and the inputs that you're going to be doing by paper and SurveyMonkey, but it will also add sections on doing a plan of care. So, for example, when you have an intake and you enter data around the child's current system involvement, maybe they have a mental health diagnosis, you'd be entering kind of support members and contacts on that team. For those of you that have done wraparound, there's a component called a strengths, needs, culture, and discovery, where you just kind of get to know the family and you record information about them. That would go into this management tool. And then, so once the child engages in services and you have a plan of care, you have team members responsible for activities. So the case manager would access this system and record progress made on goals, would record meetings and who was in attendance at the meeting. They would use this tool to send invites, maybe by email to other people to support and reminders. And then it would also have a way to capture the outcomes. So like the youth house scales and the cans could go in there. Once the data are in the case management system, we have a lot of flexibility for different kinds of reporting and how best, so the data would come back maybe at a supervisor level to the agency to help them understand their kind of caseloads and developmentally where the cases are in a cycle. Are they, how many have been open 6 months, how many have been open 3 months, kind of what some of the supports are, just to kind of help that supervisor to case manager level meeting. And then at the program level, you're like a director level or even at the state, we can use the tool to just look at how the resources are being used and the overall enrollments across counties, and just help think of it at a kind of a higher level picture. When we talk about CQI, often used in wraparound and supported by these case management tools are process evaluation components, like the % of families seen within the first 30 days of enrollment, for example, or the % of families that have at least one natural support on the team. So you develop kind of these process measures around timeliness and components being met. There's a lot of flexibility with how you want to use the input, so we're looking forward to having that team of developers help us with making sure it fits kind of broad enough that it fits the agencies and their needs. That's about all I have until questions. Thank you, Scott.
So I'm not sure if you got to this or not, but I see someone has asked a question, what if we currently have a data system? Do we have to use the Engage system? So we've kind of been discussing this for a little while, and I think what we've come up with is that at least to report the GIPRA, the Ohio scales, and the CANs, you are going to need to use our data system. But for some of the other stuff that you may use on your own site, and this kind of ties into what Chris was just talking about with your case management data that you might have, we're going to see if maybe there's some way that our systems can interact, or if you guys are really highly invested in your system, you can still use it for those purposes, but just any kind of data collection specific to Engage, you would need basically to use our system. I don't know, Chris, did you want to?
Yeah, I would say minimally, everyone will have to have the basic input so we know who's enrolled and the services they're getting, and just that they're meeting a minimum threshold of what we expected with wraparound. I think there's going to be like power users too, those that either gravitate towards the tool and want to do more with it, or those that don't have any tool, that kind of use the full capability of the system. I mean, the big picture here with the System of Care expansion grant is develop the infrastructure to support counties doing this work and reach out to more counties. So, we're working with a balance of those that have different needs, but we hope it's a tool that you'll want to use and see it less as dual data entry.
Right. I see a couple more questions popping up that I can address. I think this is asking if there is a fee associated with using the Engage data system, and no, you guys will all be given use totally free. Now we have discussed maybe sustaining the data system past the grant period. In that case, there probably would be a fee, but again, that's 4 years down the road, and hopefully by then you will have bought into the system enough that might be something that interests you, but that's that's to be decided yet. Someone also asked if for the IPP GIPRA, if you need that you submit quarterly, if you need to submit one for each county. And so I think in this case you are missing 3 different counties. I think it'd be fine to use one survey for for the combined 3 counties. I would just note on the survey that you are submitting, representing 3 different counties. And then someone also asked, will the counties have access to the county information after it is submitted? And yes, you definitely will. And I think I mentioned earlier that we're looking for people to help with the development of the data system and what kind of reports sites are going to want to see. So if you are interested in that, please volunteer to be a part of that team. I know we want this to be as helpful for you guys as possible. So if you have some specific reports that you want to see built based on whether it be your own data collection or the collection as a part of Engage, definitely we hope you take part in that process. I think that's all the questions I have for now. Jane, did you want to talk a little bit about the fidelity measures here to finish us out, and then we can take more questions at the end?
Okay, I'm off mute now. Okay. So in addition to the other kinds of data that everybody's going to have to keep track of, there's a final one, which is the fidelity of wraparound. And I think everybody who works with evidence-based practices knows that it's always important to measure fidelity, because the only way that you get the bang for your buck in an evidence-based practice is if you know that you're doing it the way that the research studies have shown you'll get good outcomes. So we measure fidelity because the relationship between high fidelity and positive case outcome has been established. In other words, it's an ongoing improvement tool for your clinical work. And we want to assess how closely your wraparound program is adhering to the core principles of wraparound, and that's what gets measured with these fidelity tools. We can talk about them more in the next slide, I think. The 2 tools are the Team Observation Measure, the TOM, and the WFI-EZ, the Wraparound Fidelity Index in its EZ form. And the way that we responded to the RFP allows your site to choose either one of these or both of them. And so I'll just briefly overview what they are and how they work, and then if you want to know more about them, I'll be happy to tell you about that in the questions part. The team observation measure measures how closely the facilitator or case manager adheres to the core principles conducting the team meeting. So what happens is, as you're conducting a usual team meeting, an observer who is trained to rate the items that are tapped by the TOM comes and sits in on the team meeting with the permission of the family and everybody else involved, and rates, then, writes down in real time, rates what's going on in the team meeting. Let's see, the things that are assessed there, it would be things like, is the facilitator or care coordinator or whatever you're calling your person that guides the meeting, is that person using primarily strengths-based language? Is there more of a discussion about how to maintain the youth in the community than how to place the youth, things of that sort? And it taps into 20 dimensions, and so you end up with items in 20 areas. The Wraparound Fidelity Index, the easy form, is a paper pencil, just a couple pages, and it measures the perspectives adhering to the wraparound principles reported by, and this can be various. You don't have to do all of these, but it's obviously better if you do. So by the worker, the parent or caregiver, and the youth. The survey instrument takes about 7 minutes to complete. That would be, assuming that everybody can read it appropriately on their own. It's written at a level to be read easily, but if somebody needs help, obviously it's going to take a little longer than that. You don't need any training to complete it. You just kind of give the people the forms, and then it can be completed on the computer, and in that case, you don't have to enter it. It can also be completed in paper pencil form if for some reason where you're meeting with your clients doesn't allow for computer access. So the Wi-Fi Easy is a pretty easy process. Then what happens with both of these measures is that they get uploaded to the RapTrack server, which is part of the Wraparound Evaluation and Research team at the University of Washington. As part of the funding for this grant, our group at CASE has procured the licenses, so there's no cost to your sites for the time of the grant for conducting the, or actually for entering your data, sorry, on the server. How the data gets entered, as you can see, we've tried to go for the Wi-Fi Easy so that you don't have to worry about data entry. For the TOM, there's a little bit more rigmarole in terms of training. You have to be trained to reliability criterion to do the observation, and that would be something that's done at the site level. And then also to enter the data, it takes less than 5 minutes because it's pretty easy. And I will work in an ongoing way with all of your sites, as sort of the conduit with the University of Washington, and their technical assistance is excellent. They're 3 hours different from us, but we always get an answer in a single day, which I think is pretty amazing. So maybe that's enough of an overview for now. I didn't include copies of the measures because I don't know that we need that level of detail at this point, but I'm happy to provide more information as people would like it.
All right, thanks, Jane. So I know we threw a lot at you guys here in kind of a short amount of time. So now, if anyone has any questions, if you just want to click raise your hand, and then I can unmute you. But first, I did see a question here that I think we could address. Someone asked, could you give examples of what counties might choose to use their funds for? And I think Chad might be the best person to respond to this, so I'll go ahead and unmute him.
right, I'm here. Thanks, Scott. What Engage is going to be paying for is the facilitation of the wraparound process and also data collection. Once you meet all of the requirements and receive those reimbursement funds to your local community, it's really up to your community on how those dollars are being spent. A lot of counties have talked about a lot of different ideas, but it's a local decision. But on our behalf, through the Engage process, we're just paying for the facilitation and the data collection. Then once those funds are received, it's your discretion on how those are spent locally.
Okay, did anyone else have any questions? If you do, just go ahead and raise your hand and I'll unmute you for the audience. Okay, I think I see another question here. Someone asked, can more than one person on a team, such as a project lead or an agency staff member, have access to the data system? And that is probably most likely going to happen. I think a lot of the RFPs we looked at kind of basically costed out their system based on the number of users. And I think the one we're going to hopefully have at least 3 user access kind of slots per county. That might change depending on how many counties are involved in each cohort and how many counties are involved at a time. But short answer to that was I'd say yes, you will be able to have a few different individuals with access to the system. Another way we might be able to get around this is kind of giving each county kind of a universal user access, and then you could just give that username and password out to everyone in your agency, and then basically anyone could go in and conduct the interviews and submit data. Again, that would be up to you depending on how you wanted to handle that. Someone else asked, can we use 5% of the funds for the administrative agency, and then also do all funds need to be expended by June 30th, 2015? Chad, do you have an answer for that?
Yes. Again, with that, basically once you receive the reimbursement from us for the requirements that you have met, it is local discretion on how those dollars are spent. So a portion of those can go to the admin agent, but it's just money that we are reimbursing you for the process. So they don't have to be spent in any sort of time period. They don't have to be spent any sort of way. It is a local decision. So it's once the money leaves our hands and you've met our requirements, we consider those funds spent. And so whatever you decide to do locally is at your discretion.
Okay, someone else asked if the PowerPoint's available to download. Yes, I'm going to send this PowerPoint and then all the forms to everyone that was on the webinar today. And then that will be available. I don't think it's going to be available on our website, but I can make sure that everyone has this, and then you can feel free to share it with others in your agency, some that might be doing the data collection. Someone else asked if any notebooks or iPads are going to be provided for these online surveys. Right now we don't have the funds to issue iPads or tablets or anything like that. And so likely in that case, I would recommend the paper method, going with the old school paper and pencil if you're going to be doing meetings off-site. That might be something in the future we can look at, but for the time being, no, we don't have any funding for portable tablets or laptops or anything. Let's see if there's any more. Someone else asked, who do you contact to volunteer to be a part of the development of the data system? So the slide I have up right now, any questions regarding enrollment, GIPRA, and funding can be directed to me or also Chad, and I can send his email along as well. And then questions regarding Engage's use of the CANs, in case any of you are particularly interested in the CANs, and maybe if you already have some individuals trained on the use of it, and you kind of want to be a part of the discussion going forward, you'd want to contact Chad or Chris Thorman for that. I've included his email. And again, any fidelity questions can be directed to Jane at Case Western. So yeah, if you do want to be involved in that data development team, email myself, Chad, or Chris. Any one of us will be happy to get you on the list and keep you in the loop moving forward. Let's see. Someone else asked, will all the resources we need, Fidelity Tools, GIPRA, Ohio Scales, be placed on the MAS website with links and downloadable files? That is certainly an idea. I'm not sure we would be able to house it on our website. It might be possible on the Engage website. But definitely all of that information is going to be readily available to you guys, whether it be on a website or either just emailing you the data files or emailing like a quarterly report of your data. It will definitely be available to you, but we kind of haven't determined exactly where it's going to be housed yet. So. Someone else asked if we're going to receive a NOSA. That is something that we are considering right now. I don't know, Chad, do you want to address that?
Yes, that's something that we have yet to decide, and that's why we're asking to hold off until October 1st to submit your enrollment forms and your initial data requirements to us. By that time, we'll have all of those processes and procedures in place. Those are decisions that have yet to be made. But one point that we do want to get to you is that you can start working with these youth. I do know that some of the counties are already getting referrals for this process for this engaged population. So please, once you have finished your 3-day trainings, the facilitator trainings, please start working with these youth, but just hold off on submitting the paperwork to us until October 1st. That way we'll have the entire process in place, and we'll have all that information ready to go to you. And you can, counties, you can also contact Joyce Calland or myself. Joyce is my colleague here at Ohio Family and Children First, and she's the West Regional Coordinator, and I'm the East Regional Coordinator. So if you have any questions about funding or anything like that, you can contact Joyce and I, and we can get those answered for you. But we hope to be ready to go and get everything underway on October 1st. So this is just a process that we want to make sure that we have correct before we start rolling out any funds to the community. So there's still some unanswered fiscal questions that we need to answer before that. So we appreciate your patience. I know some of you have been trained, facilitator training for 2 months, and you're waiting to start working with these youth, and we appreciate your patience while we roll this process out. So thank you very much.
Okay, thanks, Chad. Someone else asked, how soon do we need to make a local decision about which fidelity measure we're going to use? Jane, do you have an answer for that?
I guess sometime between now and January. I think one of the things to do would be to get in contact so that we could discuss it more in detail, answer questions for your system, so that you can go over and make an informed choice about what will work the best for you in terms of timing and workforce and all that. If I could say one other thing about what can happen now and during the rollout period, and this is something that is related but isn't directly covered in this webinar. Many people who went to training, well, the people who've gone to training have been asked to complete a training survey, which also comes from the University of Washington. And the people that were just trained in Summit and going forward are going to be asked, those who gave permission are going to be given a follow-up survey through an email link, and we just
Oh, we might have lost Jane. but it sounds like you've got a little bit of time to decide which Fidelity tool you want to use. I'm looking right now. I don't see any more questions. Last call. Does anyone else have any further questions from anything we've gone over today? All right. Well, again, any questions you have regarding the following, either GIPRA or enrollment funding, can be directed to myself, scott.wingenfeld@mha.ohio.gov. Questions regarding CANs and case management, data development system team can be sent to Chris Dorman or myself, and then Fidelity questions to Jane. Again, I'm going to send out the PowerPoint, all the forms, links to the SurveyMonkey, basically everything that was a part of today's PowerPoint, an email directly to you guys later today. Yeah, I think that's about it.
Yes, and if the individual counties have any questions, please, as I said, feel free to contact myself or Joyce Callan, and we'll be able to hopefully answer those questions. And I do know that there's some concern about getting these youth enrolled and getting your reimbursements to you. So if you have any concerns or questions about that, Joyce and I will be more than happy to have a conversation with you, and we can go over what your questions are and hopefully provide answers for you. So thank you very much.
Yeah, thanks again for agreeing to participate in the webinar today. And I know, I'm sorry, I apologize for the technical difficulties starting out. So thanks again, and again, feel free to ask as many questions as you want. That's what we're here for. All right, thanks a lot, guys.